So when head and neck cancer is detected early, this is definitely not a death sentence. These are very treatable cancers, very curable cancers, and the earlier that we detect them and treat them, the better the chances the patient has of being cured and of having a good quality of life long term. Head and neck cancer is a general term that encompasses a variety of different malignancies. The most common is squamous cell carcinoma, which arises from the lining tissues of the upper airway and digestive tract. Everything from the lips, oral cavity, throat, down to the entrance to the trachea and the esophagus. With squamous cell carcinoma of the lining tissues of the mouth and throat, most patients will have a heavy smoking and often alcohol use history. But there's also a subset of patients that's growing over time of younger, non-smoking patients who have cancers of the tonsil and tongue base that are caused by human papillomavirus. The symptoms for both of those types of cancer will be similar. So a lot of the symptoms that occur with head and neck cancer are often cold type symptoms and are attributed to a cold or upper respiratory infection, specifically sore throat, pain with swallowing, difficulty swallowing, ear pain, especially one-sided ear pain, a lump or a bump in the neck. Those would be the most common symptoms. Also hoarseness is another one. But any of those symptoms that last for more than 2 weeks are not due to a cold or an upper respiratory infection and should be evaluated by an ear, nose, and throat doctor, particularly in somebody who has a smoking history. For early stage disease, meaning cancers that are still small and have not spread widely, we try to treat with one modality of treatment. Usually that would be surgery or radiation. For advanced disease, meaning bigger tumors that have spread to more areas, have usually spread to lymph nodes in the neck, we use multiple different modalities of treatment, and that would typically involve radiation and chemotherapy together, and sometimes surgery before or after that, depending on the particular type of cancer. The radiation and chemotherapy treatment is intensive, and for patients who live far away from Tufts Medical Center, we do have the Neely House here, which is housing that's available at a very discounted rate for the patient and a family member to stay while they're getting their treatment. So at Tufts Medical Center, we have a dedicated head and neck surgery team. We have 2 head and neck surgeons who both can do the cancer removal or resection and also can do all forms of reconstruction. The other thing that we do here is we have a head and neck tumor conference that meets once a week. It's a multidisciplinary conference that involves not only the head and neck surgeon, the medical oncologist, and the radiation oncologist, but also the pathologist who looks at the biopsies, the radiologist who looks at the CT scans and PET CTs, nutrition, speech and language pathology, prosthodontics, and a number of other services. So you have multiple different doctors and other ancillary staff communicating with each other about your care and what's going to be best for you.